Here at Everyday Woman, we talk about everything, including taboo health topics. Today, Dr. Sherry Thomas is going to give us a little information about menopause, or as my mother told me, the change. Do people still refer to it as the change?
Oh, yes.
Wow. Tell me, what is the problem? Why do women have a difficult time accepting menopause?
Well, it's not just the word menopause, it's the changes that go on in the physiology of our body. And one of the biggest problems is the problem sleeping.
Okay.
So those personal summers, hot flashes, cause us to not sleep at night. And as a result, we have some personality changes. It causes us not to think well. Women multitask all the time.
Right.
I mean, the first 2 weeks of our menstrual cycle, lots of estrogen, lots of multitasking.
And we do a good job at it, my ad.
But when we go through menopause, we don't produce as much estrogen, so we don't multitask, but also then we don't sleep well. And that sleeping just really destroys our ability to have reserve and to think and to really deal with all those issues we deal with when we're having periods.
So in addition to hot flashes, personal summers, and not sleeping, what are some of the other symptoms of menopause?
Well, drier skin, especially in the vaginal area, which causes pain with sexual activity,
Okay.
Or may cause more bladder infections. Osteoporosis. We also catch up with men with heart disease about 10 to 15 years later because of going through the change. And our body, just the physiology is that we just start aging a little faster. And as women, we just hate aging anyway. So I think that's why women have such a negative connotation about menopause, is like, now I'm really going to age.
You know what? I agree with that. I think that is why women do, because you come to terms with, I'm getting older, and there's something about aging that just kind of messes with our psyche. But what are some of the health risks if I don't address this menopause, the change, aging? What are some of the health risks?
Well, let's back up to how we can go through menopause without the health risks, and that is, let's start about taking good care of ourselves.
Good.
Making sure we see our physician every year, keep our cholesterol and blood pressure and glucose under control, not smoking, exercise, eat well, and have a nice social life with our friends and our family. When we start going through menopause, there's a lot of things we can do without hormones, and we know estrogen will help the hot flashes, but how can we get through it? Well, let's keep our weight down, let's cut down on the alcohol, especially at night, because that will really increase the hot flashes.
So you're saying a little nip at night is not good for the ladies?
Oh, you know, a little nip with dinner is fine, but a little nip before you're going to go to bed, it really heats you up and causes more hot flashes. We know that. Plus, to get rid of those hot flashes and let us sleep better, cool your body down. Take a little cool, not cold, shower, or go in the pool.
But let me ask you this. As my doctor, you will help me through this process. What should I be looking for, or how would you help me if I come in and I say, I'm going through the change? How will you help me, or how should I know that my doctor is my advocate through menopause?
Well, I want to ask you symptoms, and specifically which symptoms you're having: hot flashes, problems thinking, problems concentrating, dry skin, pain with sexual activity. And then I want to ask you, how much is that bothering you? Okay. How much is that affecting your life? If you tell me, you know, I have a few hot flashes here and there, but it's not a problem, I'll say, well, let's just see how you do, but let me know if it becomes worse. And if you say, I am so overwhelmed, that's why I'm here today, I'll say, let's talk about how we can change things.
Now, what about premenopause? Because there's the notion that, you know, women later in age, but I know some people who are close to me that started their menopause or the change in their late 30s, early 40s, or even in their mid 30s.
Yes, that happens. We call that premature ovarian failure. Our ovaries produce estrogen and release follicles at a time that's genetically predetermined. Basically, when our mother goes through the change, we will. But some women, their body doesn't pay attention to that. And so in their 20s, 30s, they just stop producing estrogen. And that is very significant and very upsetting for them, because we know as women between 45 and 55, we're going to go through the change. But when women start doing that at 25, first of all, it may take them a few doctors to really diagnose what's going on. No, it's not a thyroid problem. No, you're not having some infection. No, you are going through the change. And then we start treating it appropriately.
Okay, because I know you talked about some of the health risks by not going to the doctor. So if I'm having those symptoms, what should I do tomorrow? What should I do tomorrow? If I'm hot flashing or what should I do tomorrow?
So if you're having hot flashes and you say, gee, I didn't sleep well, get a fan out, take a little cool shower, go swim the night before, don't drink the alcohol, not high, spicy foods, see how you get through the night. If you feel like the next day, I'm still just wrung out, I'm miserable, I can't go to the meeting, every time I sit through a meeting, I'm drenched, I just feel beet red and uncomfortable, go see your doctor. The fastest, quickest way to get rid of hot flashes is taking estrogen.
Okay. Well, hopefully a lot of people will be making doctor appointments today. Listen, ladies, in order to take care of others, you have to take care of yourself. If you're having a personal summer, feeling a little hot flash, or just not sleeping well, you could be starting to change. Stay tuned, Every Way Woman. We'll be right back.